A good night's sleep shouldn't feel like a luxury, but for many people it is. If you are struggling to fall asleep, waking up several times at night, or feeling exhausted in the morning, this video is for you. I'm Dr. Katia Batista, a psychiatrist, and today we are talking about insomnia. What causes it, how it impacts your mental health, and what you can do about it. Insomnia is more than just having trouble sleeping. It includes difficulty falling asleep, staying asleep, or waking up too early and not feeling fully rested. It's not just an inconvenience, it can deeply affect your quality of life. Clinically, we recognize different types of insomnia based on when the difficulty occurs during the night. These are well described in psychiatric diagnostic manual like the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, which is used by mental health professionals worldwide. Let's look at the 3 main types. The first one is initial insomnia. This is when a person has difficulty falling asleep. You may lie in bed for a long time trying to sleep but unable to turn off your mind. This type is often linked with anxiety disorders, where racing thoughts or worries prevent the brain from winding down. The second, middle insomnia, also called sleep maintenance insomnia. This is when someone wakes up multiple times during the night and has trouble getting back to sleep. It's a common symptom in several conditions, including depression, chronic pain, or even during the treatment of medications of environmental disruptions. The last one is terminal insomnia. This refers to early morning awakenings, waking up 2 or 3 hours earlier than usual and being unable to fall back to sleep. It is particularly common in major depressive disorder and often leads to daytime fatigue and low mood. These categories help clinicians understand not just that person is not sleeping, but how the sleep is disrupted, which can give important clues about underlying causes. In clinical practice, insomnia can appear in 2 ways: as a symptom of another condition, like I mentioned before, depression, anxiety, post-traumatic stress disorder, or a medical illness, or as a primary disorder where insomnia is the main problem, not caused by another diagnosis. This distinction is important because it guides treatment. That's why a comprehensive medical and psychiatry evaluation is always recommended. If you are struggling with sleep issues, remember, insomnia is more than just a bad night's sleep. When persist, it can affect your mood, your memory, immune system, and even your physical health. Then, why cannot you sleep? Let's understand the causes of insomnia. Some related to our daily habits, others connected to our physical or mental health. Let me start with irregular sleep schedules. Your body has an internal clock called the circadian rhythm that helps regulate when you feel sleepy or awake. If you go to bed and wake up at different times every day, or work night shift and try to sleep during the day, your body clock can get confused. That makes it harder to fall asleep and stay asleep. The second one, too much screen time before bed. Phones, TV, which can trick your brain into thinking it's still daytime. This reduces melatonin, the hormone that helps you sleep, and can delay your sleep cycle. The third one, stimulants like caffeine. Caffeine is not just coffee, it's also found in teas, sodas, and energy drinks. Caffeine is your brain alert. If you're consuming too much late in the day, it can interfere with your sleep. The fourth one, medications that interfere with sleep. Some medicines can keep you awake without you even realizing it. For example, antidepressants like fluoxetine or bupropion. Those medications, they are prescribed for common conditions and interfere with the sleep. Stimulants like methylphenidate, Ritalin, or amphetamines in general. Diuretics, those medications prescribed for hypertension, cause nighttime trips to the bathroom. Beta blockers like propranolol, often used for blood pressure or even anxiety, can disrupt sleep in some people. If you take medication and have trouble sleeping, talk to your doctor. Never stop medication on your own. The fifth one, mental health conditions. Sleep and mental health are deeply connected. Mental health conditions directly disturb sleep. Here are a few examples. Anxiety disorders. People often lie awake with racing thoughts or worries, feeling unable to shut off their minds. This makes it harder. In depression, people with depression wake up very early in the morning and cannot fall back asleep. It's what we call early morning awakening, or feel unrefreshed after a full night's sleep. In bipolar disorders, during manic episodes, People feel full of energy and often sleep very little or not at all. Need sleep because their minds are full of ideas and plans. Psychotic disorder is another example, like schizophrenia. People may have trouble sleeping due to disturbing hallucinations, such as terrifying visions or hearing voices, which cannot prevent the brain from relaxing. Chronic medical conditions and pain. If you live with conditions like arthritis, chronic pain, like I said, sleep can become very disruptive. Even needing to get up to urinate at night due to conditions like diabetes or an enlarged prostate can fragment your sleep. Substance use is very common. Alcohol, nicotine, and drugs can interfere with sleep. While alcohol makes you sleepy at first, it often leads to waking up throughout the night and diminish the sleep capacity. Heavy meals before bed. Eating a large or a spicy meal late at night activates your digestion and may cause discomfort or indigestion, keeping you up. Some people also heartburn when lying down too soon after eating. Late night exercises is healthy, but intense workouts just before bed may keep your heart rate and adrenaline levels high, making harder to wind down and fall asleep. Understanding the root causes is the first step toward healing. When it comes to treating insomnia, it's important to know that there is help and there is treatment, and it's effective also. The treatment is personalized based on the type or sleep disorder that you present. We divide treatment into non-pharmacological, behavioral, and lifestyle strategies, and pharmacological medications when is needed. In the non-pharmacological, sleep hygiene is important, building a foundation for a better rest. The good sleep hygiene is the first step. It means creating a healthy sleep environment and consistent routines. Here's what that looks like. Go to bed and wake up at the same time every day, even during weekends. Use your bed only for sleep and intimacy, not for watching TV or scrolling on your phone. Make your bedroom cool, dark, and quiet. Consider blackout curtains or noise machines. Avoid screens, phones, tablets, TV at least 1 or 2 hours before sleeping. Avoid caffeine, not just coffee like I mentioned, also teas, energy drinks, soda, even dark chocolate, at least 6 hours before bedtime. Avoid heavy meals or late night snacking, which can activate digestion and disturb your circadian rhythm. Be mindful of intense exercise late at night, as it may keep your body too alert to sleep. Cognitive behavioral therapy for insomnia. CBTI is considered the first line treatment. Is considered the first line treatment for chronic insomnia. It's a structured, evidence-based form of therapy that helps people challenge and change unhelpful talks about sleep, reduce anxiety around sleep, break patterns of wakefulness in bed, and learn relaxation techniques like deep breathing, progressive muscle relaxation, or mindfulness. These are being shown in studies to be more effective than medication, especially the long term, without any side effects. Pharmacological treatment is useful. Treatment with medication sometimes is needed, and we prescribe it when symptoms are severe or where there is significant distress or impact on functioning. When other treatment, like I mentioned before, haven't worked alone. These medications include sedative hypnotics like solpidem, melatonin receptor agonists like Ramiltion, certain antidepressants with sedative properties like trazodone, mirtazapine. Even in some cases, we may prescribe antipsychotics. Just the use is for short term with under close supervision, like quetiapine. But it's important to remember, medication is not a first or only solution and should always be prescribed and monitored by a physician. Self-medicating, even with natural or over-the-counter sleep aids, can be harmful, especially if there are underlying mental or medical health conditions. Also, some medications may cause or worsen insomnia. Like I mentioned before, let me repeat it here briefly. SSRIs like fluoxetine, sertraline, citalopram, escitalopram, stimulants like methylphenidate, we prescribe it for ADHD and other mental illness, beta blockers as propranolol, diuretics, which increase nighttime urination, worsen insomnia. If you are taking any of these, speak with your doctor. Don't stop them on your own, may just need to be adjusted. In summary, creating healthy routines, addressing mental health, reviewing medications, and sometimes introducing therapy or sleep aids all personalized for your needs is needed. Sleep is a vital part of your mental health. If this video was helpful, please subscribe to my YouTube channel, DrSoulRise, for more evidence-based content on mental well-being. Thank you.